Hello and welcome to our listeners here to the Mass Violence Podcast. We have a really incredible episode planned for you today. I am Carter Coyle. I'm the Public Information Director at the National Mass Violence Center. And the Mass Violence Podcast is an opportunity for us to welcome special guests onto our show and take a deep dive into topics and learn more about them and how they relate to NMVC's goals of preparation and response and recovery for mass violence. Today, we are honored to welcome Dr. Staci Beers from the FBI onto MVP. Dr. Beers has worked in victim services for more than 30 years. She tells me she's always worked in a system-based agency, so she's been in law enforcement, probation and parole. She was in Florida for a while before moving to DC, where she has worked for the FBI Victim Services Division for 14 years now. And I imagine that is both a very rewarding and emotional job. So, Dr. Beers, I can't wait to hear about what you do in this new training, this new trauma notification training that you have been working on. Welcome.
Thank you very much. I look forward to our conversation.
So, Dr. Beers, let's just lay the groundwork for our listeners first. Could you give us an idea of what the FBI Services Division does and how your services tie into what we do here at NMVC with mass violence preparation and response, recovery, and resilience? What does the Victim Services Division do?
So the FBI's Victim Services Division, which we call VSD, plays a critical role in providing assistance and resources to victims of crime as well as their families. So on a global level, VSD provides direct services and assistance to U.S. citizens and families who are victims of international or domestic terrorism, mass violence crimes, international hostage taking, kidnapping for ransom. We also support criminal transportation disasters and other crimes. A lot of our support includes medical evacuations. We repatriate remains, autopsy coordination, personal effects management, emergency victim assistance funding, and post-captivity support. Our mission really is to inform, support, and assist victims in navigating the aftermath of crime and the criminal justice process with dignity and resilience. Engagement with victim services, we have found, results in better investigative and prosecutorial outcomes. So, when we place a high priority on identifying and addressing victims' needs, it's beneficial in a lot of ways. It not only promotes their safety and recovery, it reduces further victimization, but it also plays a very important role in obtaining positive investigative and prosecutorial outcomes. For us, engaging with victims is also federally mandated. According to the Attorney General guidelines for victim and witness assistance, department personnel are required by law to identify victims of crime, to notify them of their rights, and offer them services as they are described in the Attorney General guidelines for victim and witness assistance. We have a Victim Services Division has specially trained personnel located in all 56 field offices and at FBI headquarters to ensure victims of crime are immediately supported in the aftermath of a crime by someone with knowledge of their community and resources available to them. We also have victim services professionals in the following roles, and I'm just going to highlight what those roles are. So we have approximately 175 victim specialists throughout our 56 field offices. They reside in their field offices, and they're responsible for serving as the primary point of contact and they liaison with victims to provide services, information, referrals, and also coordinate case status updates. We have 24 child adolescent forensic interviewers, and they're regionally based across the field and support FBI investigators by conducting interviews for any victim or witness who is a minor, developmentally delayed adult, or adult with unique case circumstances. We have 7 victim services coordinators, of which I am one. We reside at headquarters and are responsible for victim response in our international and domestic terrorism, mass violence, and other specialized cases. We work closely with our field offices, our legal attaches, U.S. embassies and consulates, as well as other headquarters divisions. We have a hostage recovery fusion cell family engagement coordinator, and that role resides at headquarters and reports to Victim Services Division and provides information and support to hostage families and specialized post-captivity services to recovered hostages. We have 2 operational psychologists, and they reside as well as headquarters and provide direct services to victims and their families. They have specialized experience working with hostages and adult kidnapping victims. They provide guidance and support to FBI personnel, non-FBI mental health practitioners, as well as external partners when interacting and assisting victims. Our approach is really to tailor the assistance to fit the specific needs of each victim because every victim is unique as well as their circumstances. We don't just engage in local communities in the aftermath of crime. We are constantly tracking the resources available in the community as well as engaging in community outreach to ensure that members understand what services the FBI VSD can offer. Um, we know that having VSD personnel living and working in the communities we serve ultimately leads to greater cultural sensitivity, context, and knowledge, which enhances future assistance from the FBI. We also have the benefit of providing professional support for victims of crime during traumatic events. We provide a conduit for information sharing between the victim families and their case agents. We provide continuity and stability to victims throughout the life cycle of the case. We increase cooperation throughout the investigation and enhance the FBI's public relations during a crisis event. So we have a variety of special programs that I'd like to highlight. We have our Victim Services Response Team, and that's a multidisciplinary team that consists of agents, analysts, victim specialists that provide operational support in crisis and mass casualty events. And we play key roles in supporting victim family crisis assistance for state, local agencies following active shooter and other crisis incidents. We also, I talked about our child adolescent forensic interviewers. We have a child exploitation notification program, and they maintain a centralized tracking system for identified children whose images appear in produced, possessed, or traded pornography, and manages victim communication to reduce the re-traumatization. The program was recently renamed in 2024 to more accurately describe the nature of the program, align with current terminology in victim services field, and emphasize the program's focus on ensuring notifications are made to victims. We also have the Victim Outreach Strategy and Support Unit, which we call VOS, and they assist with large-scale victim management to include victim identification using our Seeking Victims FBI.gov web pages, victim notification facilitation, victim questionnaire development, data and trend analysis. We can establish public 800 numbers, FBI, Facebook, and X, formerly Twitter media blasts. We also have our Crisis Response Canine program, which I'm honored to be one of the Crisis Response Canine handlers for CRC Wally.
Oh,
And these are
that's great.
specially trained canines and handlers who engage with victims to mitigate stress and anxiety resulting from exposure to violent crime, mass violence incidents, and other crisis incidents. And of course, we have our trauma notification training, which provides training to FBI personnel, other law enforcement agencies, first responders responsible for delivering death and trauma-related notifications to family members following a crime, mass violence or crisis event, suicide or other type of incidents to ensure notifications are provided with professional dignity, compassion, and without further traumatization. So when you asked how we interface with you, our rapid deployment team, our crisis response canine program, and also VOS often interfaces with the National Mass Violence Resource Center, National Mass Violence Center, new name. And so we're often interfacing with you all throughout our deployment as well as in the aftermath of these incidents.
That is absolutely incredible, the amount of work and the breadth of work that your division does. And hearing you describe all of this, I really see how that intertwines with the NMVC's goals of being victim-centered and relying on evidence-based practices. But man, you all do a lot, and it is very impressive. You just kind of mentioned death notifications, trauma notifications. So can you elaborate on that, Dr. Beers? What does that mean in your world? How does that process work to make sure that a death notification is sensitive to survivors and trauma informed?
So our model was developed in 2015, and we actually created the model from Mothers Against Drunk Driving's model. We did not develop it, but we put it on an online platform so that people were able to access it free of charge, and readily accessible. What we know is that Death or trauma notifications are generally delivered by law enforcement throughout the United States to families and their next of kin and victims that are following a crime. That can include a mass violence incident, motor vehicle accidents, suicides, overdoses. As part of this delivery process, a victim services provider could be a victim specialist, could be a victim advocate in a law enforcement agency. They often work with the police officer to deliver that notification in person and ensure that these families and next of kin have the support needed following the tragic news.
And there's no way that someone from the FBI could possibly do all of these notifications throughout the country. So it seems like you and your team have found ways to educate people and offer this training so that there is maybe some consistency in this and the sensitivity and the ways that law enforcement officials or other agencies are doing these notifications. It must be a really difficult part of someone's job. So, in addition to your training, I mean, are people required to get this sort of training? Do you wish more people had it? What kind of training do they get for these notifications?
So this is a good question, and the FBI is not generally the front line of making these notifications. It's usually law enforcement, or it could be medical legal investigators with the local coroner or medical examiner's office. What we know and research has shown that most first responders don't get any formalized training to do these notifications. They're usually with their training officer when they go out to do them. And so our goal is really to make this online training accessible for anyone who's tasked with doing these notifications. And so the more people that get trained, the better it will be for victims and their families receiving that notification.
And the program you referenced earlier that started in 2015, that was the We Regret to Inform You program. Is that correct?
That's correct. And since 2015, since we launched that, we had about 40,000 allied professionals who've taken that training online.
I've heard you reference trauma notification. So how's that different from a death notification and how have y'all adapted?
So what we found is that using this four-step model applies not just to death, but to other traumatic situations. So it could be a child abduction, could be an exploitation case, it could be a kidnapping for ransom case. So anytime we're interfacing with a victim and we have to deliver difficult news, we can use the four-step model. And so what we did was we rebranded from death notification to trauma notification as this model that can be used in those traumatic situations.
And that's where the trauma notification training comes in and that you have helped develop. Is that correct?
That's correct. We developed this training, as I said, originally in 2015, and we certainly want to make sure that it's timely and that our information is evidence informed. And so we recreated some of the material. The four-step model still applies, but what we've been able to do is really enhance it. And so in April, earlier this year, during National Crime Victims' Rights Week, we launched the trauma notification training on FBI.gov, and we've developed a mobile app available on iOS and Android operating systems. And so what we found is that this training can help law enforcement as well as victim services providers deliver these notifications to family members in a really efficient manner. Um, you know, we have enhanced it with numerous things and numerous capabilities, including 8 new videos that highlight cultural competencies. We highlight specific challenges as well as best practices when delivering a trauma notification. So folks can go on and they can review the actual training as well as the videos, which will come up with challenges as well as best practices, and they can learn throughout the videos that we produced. The training is offered primarily online. We do offer it in person within the FBI, but there's also an instructor's resource so that law enforcement academies or any kind of educational component can actually tap into the instructor resources where it has the slide deck as well as the facilitator's guide, the scenarios, that sort of thing, so they can reference them and they can share that information with their constituents. So those are some of the things that we were able to highlight. From a cultural perspective, the videos include some scenarios in Indian country, the LGBTQIA plus communities, individuals who may have language barriers, and that sort of thing. We've been able to transition from the We Regret to Inform You training, which was on Penn State University's website, to now FBI.gov. So people can find it at fbi.gov/trauma notification. The app, as I said, is now available on both the iOS and Android operating systems. And so the app really will give individuals who've taken this training a quick and easy access to the 4-step trauma notification model if they want that quick refresh. It also has access to VSD's Coping with Grief brochure, which is translated into 11 different languages. It has an online lookup feature with contact information for domestic law enforcement agencies, hospitals, coroners, and medical examiners as well. And so, we certainly have it out there. Available to all first responders and victim services providers, but it's accessible to the public as well. So folks may be in a medical facility that want to learn how to do this. So even if you're not on a trauma notification team in your community, or that's not in your position description to deliver this formal notification, you can still go to the training for your own personal awareness.
That makes so much sense from the hospital angle too. A nurse or a doctor, or someone who's put in a position of making that notification maybe in the moment,
Mhm.
making sure that they have some skills that they've been equipped with. Are there, you mentioned who this is for, primarily law enforcement, but there's lots of other folks who could benefit. Do the people who are doing the training need any special skills or training before they sign up for this? I mean, are there personality traits that maybe make you better at trauma notification training, or could anyone learn how to do this sensitively?
I think anyone can certainly take the training. I do believe that there is a certain person that has to have certain characteristics to do the training. Certainly, somebody that's compassionate, that has really good listening skills, can sit in the moment with people and be silent sometimes when there's nothing really to say. And so there is a certain type of person I think that is well versed for this. But we also know that people are thrown into these positions just based on their roles, and so our goal is to hope that when taking this training, they'll be able to assimilate those skills in order to make these notifications.
And I wanted to back up just a little bit about the concept of trauma notification and how important this is. Can, making sure that someone is trained when they're delivering this sort of horrible news to a family, can that training or their sensitivity impact how that family recovers or becomes stronger or receives the news? It seems like this is really important for the families.
Yeah, one of the things that we say is that when a notification's being provided, this is the first time that law enforcement is building rapport with the family. So if it goes well, meaning that if it's done in a sensitive, compassionate manner with professionalism, families may be more willing to want to speak to us as law enforcement. But most importantly, it can impact their grieving process. And so if it's done in a poor manner, we know that the grieving process can be complicated moving forward for the families. So our goal is to make sure that anyone has access to this who is providing the notifications, so that families' long-term coping skills, as well as their ability to mourn and to grieve, aren't significantly impacted in a negative manner.
And I imagine, especially if a crime's involved, to trust law enforcement, to do their best moving forward. And how and then y'all are involved from that point forward. I imagine it's not just a quick notification and you're done. The people who deliver this news might be in contact with the family moving forward. So building that relationship up front is really, really important.
Absolutely, because there's resources that may be available to those families. And so if it is not done in a well-informed manner, they may not want to take a call from us or have us visit again. And so then they might lack access to resources, which is really, really critical for these families.
I understand, Dr. Beers, that you've already traveled to dozens of your FBI field offices to deliver this new training. So not only can folks do it online, but you're helping train some of the field offices across the country. What has that been like? And what a big undertaking on your part, but what's the feedback been so far?
We've had really positive feedback for this. I always say that the FBI is not involved and we're not responsible for fatality management. That really is up to the local communities. But what we found is in the aftermath of mass violence incidents, we've often been asked by the local community, law enforcement, coroners, or medical examiners to provide these notifications. And so we've trained 32 field offices out of 56 currently. We've trained over about 800 FBI agents, task force officers, victim specialists, our linguists, and our employee assistance program. And so we've been able to go out and do these trainings so that we are prepared in the event that a community does ask us to step in and do this. We can also use it for our own. So we have someone within the FBI family who has died in the line of duty, who has been injured in the line of duty, maybe who has suicided. We're able to use the four-step model with our trained teams in order to make these notifications to their families as well as our own employees.
It strikes me how important this is to be accessible to everyone because, especially in a small law enforcement department, if only one person has training and they experience something like a mass violence incident, one person isn't going to cut it. You need multiple people across the
Yes.
board with this training.
Yeah, our model is that you need a team of two per victim in order to do this kind of a training. And that's I understand with some law enforcement agencies will say, well, I don't have two, right? We might have a very small force and a small law enforcement, presence in their community. And so it's just a best practice to have two people. But we understand that the training and the approach may have to be scaled down to fit the needs of that law enforcement agency.
This has been so interesting, and it's really giving a snapshot of how important the aftermath is for a family and for building that rapport with law enforcement and trust that and during an investigation. Is there anything else that you'd like to us to include, or Dr. Beers, have I missed anything, or is there anything mass violence specific you think is relevant to include here?
I don't think so. Just to make sure that folks have the website where they can find it. It's www.fbi.gov/trauma notification, and then people can access the materials right from there.
I love the idea of talking to you further about being a crisis response canine handler. That sounds super interesting. So maybe a tease ahead to another episode.
Absolutely.
Thank you, Dr. Beers. It was so nice to talk to you and to learn about the sensitive victim trauma notifications, death notifications that your team handles, but more importantly, the training you've developed to show other law enforcement agencies across the country how important it is to handle trauma notifications with dignity and compassion and help victims recover. So, thank you for what you do. Thank you for this training that you're implementing. And I hope our listeners have learned a little bit of the inside scoop here with the FBI. Dr. Staci Beers, thank you so much.